Greetings. The topic of this podcast is how to navigate healthcare and health insurance in the USA. Let me start with a little story to get you thinking. Picture this: you're sitting in your doctor's office, and the bill comes in $2,000 for a routine checkup. Wait, what? You thought your insurance covered that? Sound familiar? Yeah, that's the reality many face when trying to navigate the complex world of healthcare and health insurance in the USA. So today, we're diving into how to actually make sense of this maze and, more importantly, how to choose the right health plan and maximize those benefits without burning a hole in your pocket. Let me take you to a little coffee sandwich moment at the office last week. So, there I am, chatting with my colleague Sarah. She just got her insurance renewal letter, and she's seriously confused. She was like, "I've been paying into this plan for years, and I still don't know what's covered." I laughed because, honestly, I think we've all been there at some point. But here's the kicker: Sarah works at a tech company, making a decent salary, but she's still navigating this insurance puzzle. It's not just about paying the premiums. It's about figuring out what benefits you actually get and how to maximize them. And folks, this isn't just a Sarah problem, this is something a lot of people face across the US. So, let's break it down. First things first, healthcare in the USA is a beast. You've got public options, private insurance plans, and everything in between. The key is to understand the basics before diving into a plan. Now, I want you to picture this: you're at work, scrolling through your emails and come across your health plan options for the year. The first question pops up: what's covered? You want to know about doctor visits, prescriptions, emergency care, maybe even dental and vision coverage. Your first thought is, do I need all this stuff? And the second thought is, how much am I paying for it? Here's the deal: health insurance is all about understanding coverage. And no, it's not just about choosing the lowest premium plan to save a buck. You need to look at the total cost: premium, deductible, copays, and out-of-pocket maximums. If you're paying $100 a month for a plan with a $10,000 deductible, that plan isn't doing you much good unless you're rarely sick. Now let's answer some of the most common questions I hear all the time. First off, what's the difference between HMO and PPO? Good question. HMO stands for Health Maintenance Organization. It's usually cheaper, but you'll need referrals from a primary care doctor to see specialists. PPO, or Preferred Provider Organization, gives you more flexibility, but at a higher cost. Choose wisely based on your health needs and budget. So here's another funny situation from work. My friend James, who's an accountant, found himself in the emergency room last year. His insurance didn't cover the full cost because he went out of network, and he didn't even realize it. James was livid. I mean, he had the insurance but didn't fully understand the network restrictions. So, lesson number 2, always check your network. In-network providers save you a ton of money, and out-of-network providers can make your bills skyrocket. Oh, and remember that office coffee sandwich event I told you about? Sarah and I were chatting with our HR about insurance plans. And guess what? They mentioned something crucial: open enrollment is the time to adjust your plan. If you're looking for lower deductibles or better coverage, you've got to make those changes during that period. Outside that window, you're stuck until next year, and trust me, you don't want to be stuck with bad coverage. Alright, here's the sauce ingredient, the one thing I really want you to take away today: maximize your benefits. Whether it's free preventive care, prescription discounts, or wellness programs, make sure you're using what you're paying for. It's like getting the most out of your gym membership. Don't just have it, use it. Some commonly asked FAQs by our viewers. How do I choose the right health insurance plan in the USA? Look at premium, deductible, and coverage. Check if your doctors are in-network and explore employer plans versus marketplace options. What's the difference between an HMO and PPO plan? HMO is cheaper but more restrictive, PPO is more flexible but pricier. What is an out-of-pocket maximum? It's the most you'll pay for covered services in a plan year. Once you hit it, your insurance pays 100%. Can I change my health insurance plan during the year? Usually only during open enrollment unless you have a qualifying life event, marriage, moving, etc. What's covered under preventive care? Checkups, vaccinations, screenings. These are usually free under most plans. Are prescription costs covered? Some plans offer prescription drug coverage. Check your formulary to see which meds are covered. What happens if I miss open enrollment? You can't change your plan until the next open enrollment unless you qualify for special circumstances. How can I lower my health care costs? Choose in-network providers, use preventative care, and maximize your health savings account, HSA. Is dental and vision insurance included? Typically, no. You'll need separate coverage for dental and vision in most cases. What is the Affordable Care Act, ACA? It's legislation that provides health insurance subsidies and expands Medicaid eligibility. It helps lower costs for low-income individuals. Tips for navigating healthcare and health insurance in the USA. Understand your plan's network. Before choosing a health insurance plan, carefully review the network of doctors and hospitals that are covered. In-network providers typically offer lower rates, so be sure your preferred doctors are included. If you frequently visit specialists or have specific medical needs, this is crucial. Look beyond premiums. While low premiums may seem attractive, they can often be paired with high deductibles or copays. When comparing plans, consider your total out-of-pocket costs, including premiums, deductibles, and copays. This will give you a clearer picture of what you'll be paying. Take advantage of preventive care. Many health plans offer free preventive services such as flu shots, cancer screenings, and wellness checkups. These services are included at no extra cost, but you need to take advantage of them. They can help catch health issues early, saving you money in the long run. Use an HSA, health savings account. If you're enrolled in a high-deductible health plan, consider using an HSA. It allows you to save money tax-free for medical expenses. The funds roll over year after year, so it's a great way to build a health savings cushion for the future. Maximize your benefits. Health insurance isn't just for medical care. Many plans include perks like gym discounts, wellness programs, and even mental health support services. Explore your plan's full range of benefits and take advantage of everything available to you. Review your plan annually. Health insurance isn't one size fits all. What worked for you last year may not be the best choice this year, especially if your health or lifestyle has changed. During open enrollment, take the time to compare plans again and adjust your coverage as needed. Consider telemedicine. Many health insurance plans now include telemedicine services, allowing you to consult with a doctor remotely. It can be an affordable and convenient way to get medical advice without the need for a physical visit. Shop around for prescription drugs. Prescription drug costs can vary significantly between pharmacies. Use discount programs or apps to compare prices before picking up your medications. Some pharmacies offer loyalty programs that can help lower your prescription costs. Check for financial assistance. If you're struggling to afford insurance, explore options for financial assistance. The Affordable Care Act provides subsidies for those with low incomes, and Medicaid may be available for those who meet eligibility criteria. Know your rights. Familiarize yourself with your rights under the ACA, especially regarding coverage for pre-existing conditions, preventive services, and emergency care. Knowing what's legally required can help you advocate for yourself if you feel your insurance isn't covering what it should. By following these tips, you'll be in a better position to navigate the complex world of healthcare and insurance in the USA, ensuring that you get the most value for your money. Disclaimer: The information provided in this podcast is for informational purposes only and should not be construed as medical, legal, or financial advice. Always consult with a licensed healthcare professional, insurance advisor, or financial expert before making any decisions regarding your healthcare coverage or financial matters. Health insurance plans, coverage, and regulations may vary by state and are subject to change. We do not endorse any specific products, services, or companies. Every effort has been made to ensure the accuracy of the information presented, but we recommend verifying details with your provider or relevant authorities. Thank you.